Hello, nerds! Nerds for humanity. A lot of you have been asking for me to do a video breaking down the complexity of healthcare in America. So we're going to go over Andrew Yang's original healthcare proposal back in December of last year before he had to suspend his campaign. Why it was a little bit different than just saying Medicare for all. We'll also look at some facts about how the American healthcare system works today. We're also going to have 12 amazing charts about the state of American healthcare. And then finally, we'll do a quick comparison of the American healthcare system versus some other developed countries. With that, let's start with Yang's healthcare proposal. I think the most important thing is it was a six-pronged approach. So much in keeping with Andrew's campaign. It was very detailed. I think the media really didn't pick up on it too much, but it's useful to look at it today and see that, yes, of course, universal access to healthcare is crucial, but there were a lot of problems that the Yang proposal was focusing on that I think other candidates didn't. Obviously, there was a first issue of prescription drug pricing through negotiated purchasing, international reference pricing. I think, in fairness, other candidates had talked about this. The second one is something that now a lot of us are talking about, but Andrew Yang was talking about last year, which is the importance of things like telehealth, to use technology to make healthcare delivery faster and more efficient. The third was really looking at the incentive structure, how we are paying providers, how the system works in terms of the paperwork that healthcare providers have to fill out in order just to take care of a patient, as well as increasing the supply of practitioners. Next, Andrew also talked about the need to focus on preventative care as well as end-of-life care options. These are topics that really get into some of the key drivers for the crazy costs of healthcare, basically the problem of waiting till you're sick to get treatment versus avoiding becoming sick. And of course, the care that some of us get at the very end of our life can sometimes be as expensive as the care we were getting for the majority of our life prior to that. Fifth, he talks about ensuring well-being, including mental health, health with disabilities, HIV/AIDS detection and treatment, reproductive health, basically thinking about dental, vision, mental, all of your care as an integrated and comprehensive system. And lastly, the importance of diminishing the influence of industry lobbyists in the healthcare industry so that we can actually pass meaningful healthcare reform. So if you're curious about this stuff, you could go, the Yang 2020 website is still up and you can go into more detail about each of those 6 points. But that's a quick summary of what Yang was proposing. And I will just say it comes across a little bit more thoughtful, a little bit more nuanced, a little bit more practical than, just some kind of bumper sticker approaches. But, hopefully he'll run again. So why is healthcare such a big deal? Well, the Brookings Institution, which is generally considered a nonpartisan think tank, did a great summary here. So kudos to Ryan Nunn, Jana Parsons, and Jay Shambaugh, who did all the hard work. But let's look together and see what they came up with. So the first chart here looks at the U.S. healthcare expenditures as a percentage of our gross domestic product from all the way from 1960 to 2018. And what's really interesting is way back in 1960, we only spent about $1 for every $20 on healthcare expenditures as a country, so about 5%. Unfortunately, it has been going up consistently to a point now where we're almost 20% of our GDP. For every $5 of domestic product that America spends, one of those is on healthcare. And if you extend that line further, at some point, it becomes potentially unsustainable. Like, I don't know if we'd want to spend half of our GDP on healthcare. That's money that we could spend on education, on leisure, on housing, on food. So It's clearly a problem. And in fairness, this is not a Republican or Democrat issue. Certainly, there are some periods where the line was a little flatter than others, like certainly in the late 90s, it kind of flattened out. You could argue in the 2008 to 2016 era, it was kind of flat, but certainly in the early 2000s, it was pretty bad. In the late 2007, early 2008 was pretty bad. But even in those best times, it was still a very large chunk of our overall national spending. Now, when you break down who's paying for it, part of it is public spending. So public spending went from about 3% of GDP to now close to 7%. But private and household and business spending has gone up significantly as well. Looks like it's gone from around 6% to now 10% of GDP for healthcare is now borne by individuals, businesses, households, and other private sources. So this is not just a big government problem, it's also a big bill for individuals and companies problem. Here's another one looking at for government spending. Out of all of the money that the US government spends, we are now up to about almost 1 out of every 4 government dollars are for healthcare. And that was only 10% back in 1987. So in the last 30 years, it went from a tenth of the federal spending to now almost a quarter. Now, if you look at the actual dollar amount per person spent in the US, we've gone from spending on average around $3,000 per American for healthcare each year to now over $10,000 per American each year. And when you look at that broken down by age group, certainly younger folks, 44 and under, are still spending less than $5,000 a year on healthcare, although that's a serious chunk of change. But when you look at the 85 and older group, that's $35,000 per year just on healthcare. And even for the retirees that are just 65 to 84, they're pushing almost $20,000 in healthcare spending per year. This is an interesting chart because it shows that this is not just America's problem. Other countries spend a significant amount of their GDP on healthcare, but we do spend considerably more than other countries. So again, US, we're at 17% of our GDP, and we have a very big GDP. So you would imagine that we should have some economies of scale, yet we aren't seeing that. In fact, you look at Japan and Germany, they are spending closer to 11% of their GDP. And later on, we'll talk about the results for the money that these other countries are spending. This chart shows you where the money is going within the US. So for that 17% of our GDP, where's the money going? Well, the largest is to hospitals, and then professional services, followed by long-term nursing and home health care. And then it's prescription drugs, health insurance, investment, medical equipment, government administration, government public health activities. This chart looks at how much we're spending on healthcare based on people's self-reported health. So people who believe that they're in excellent health will typically spend on average about $2,000 per year for their healthcare. And then you can see the difference where people who are in fair or poor health can spend on average either $14,000 or $26,000 a year on healthcare. And if they're in the 90th percentile, like the least healthy of that poor health group, the expenses per year can be $70,000. And even for the fair health group, the 90th percentile, the top 10% most expensive, are pushing at almost $34,000 a year in healthcare expenditures. Here's an interesting chart showing the disparity of pricing for blood tests. So basically the dots represent the median, the 90th percentile, and the 10th percentile. So the cheapest, the middle price, and the most expensive. In Missouri, you can actually get blood tests for a pretty reasonable price. Probably looks like close to maybe $50 or something like that. Washington State, Maryland, similar. Whereas in Texas, you'll notice that the cheapest blood tests are still more expensive than the most expensive blood tests in Maryland and Washington. And the max for some of these blood tests in Texas can be over $600, close to $1,000 if you're in El Paso. Now, either Texas has some super advanced blood testing that the rest of the country doesn't have, or the competitive forces of the market are not doing their job at getting the price closer to cost. Similarly, this looks at the price of a C-section. If you're in Tennessee, Louisiana, Ohio, you certainly can get them for close to $5,000 to $7,000. If you are in San Francisco, the cost can range from $15,000 to $40,000. Or San Diego, it can go up to $30,000. Indiana, also, Indiana C-sections cost more than the most expensive C-sections in Tennessee. Here's what the cost is of the same procedure in different countries. So the US price is this dotted line, and basically every other country on this graph is a fraction of what the US prices cost. So if you're in the UK and you need a knee replacement, it's pretty much going to cost you less than half of what the American offering would cost. If you are in the UK and you need a C-section, also less than half. And you see Australia is about 1/3 off the US price for a hip replacement. Now, you might be thinking, well, those American knee replacements are way better than the ones in Australia or in the UK. I'm not sure if that's true, but certainly this bottom section looks at prescription drugs, which are by definition identical. Let's say for Xeljanz, you could pay 1/3 off in Germany for the exact same chemical compound from the same provider, the same pharmaceutical company, or you could actually pay 90% off if you were living in Holland. Or if you're in the UK, it's about 80% off of what the US patient is paying. Ironically, many of these pharmaceutical companies are American pharmaceutical companies. So you have to wonder, why are American companies charging Germans and British and Dutch a fraction of what their home country is being forced to pay? Here's a chart of market concentration over time. And you see this first dotted line, if you're in this neighborhood, it's considered high concentration. If you're under here, it's considered moderate concentration. And generally, economists would argue that if there's too much concentration, there's too much pricing power, and the consumer is unable to get a lower price for their services. If you're in the market for hospital services, specialist care, or even if you need insurance, there is relatively high concentration. Whereas if you need primary care, there's a little bit less concentration, but still considered high by economist standards. Here's a comparison of the administrative costs as a share of GDP. We all know that there's a lot of paperwork and red tape involved in our current healthcare system, and that is borne out by the data, which looks at Norway, Denmark, Sweden. Less than 0.1% of their GDP is spent on administrative costs, both for the payers and the hospitals. Whereas in the US, just the payers' administrative costs or the hospital administrative costs, either of them, is higher than the total administrative costs for the United Kingdom, Australia, Japan, Sweden, Denmark, and Norway. Lastly, this is an article from 2017, but still quite relevant, by the New York Times, comparing healthcare systems across different countries. And so let's just take a quick look at what they came up with. So the first comparison was among Canada versus the United Kingdom, which involved the single payer system. So this is where the government finances health insurance. You don't have private insurance companies. You don't have companies buying separate insurance plans and then having different ones when you change jobs. This is as close as it gets to truly socialized medicine. And here, most experts believe that the UK has really gotten the best version of single payer. Experts consider it rather low spending with great access and acceptable outcomes. Patients in the UK still have the option to get additional private insurance so that then they can further shop across providers. UK has lower costs to access, whereas in Canada, it's quite well known for having access problems where you can actually have to wait many months for elective surgery. However, many believe that the Canadian system could be simpler for citizens to understand and might be a little bit more equitable. Then there's the US versus Singapore model. Obviously, in America, we have private insurance, but we also have socialized healthcare through Medicare. Fun fact, if you are on Medicare or members of your family are on Medicare and you are against socialism, you are benefiting from a socialist policy because I did another video showing how people who are using Medicare are taking more out than they originally put in. Singapore has also a mixed model with some government-run hospitals and then some deluxe care options available if you want to pay extra. Singaporean workers are required to contribute almost 40% of their wages to mandated savings accounts, which then can be spent on healthcare, housing, insurance, education. Who wins? Generally, most people think that the US healthcare system is superior to the Singaporean one. People find the Singaporean model intriguing, but most people would agree that forcing Americans to tuck away 40% of their earnings for savings towards healthcare, education, housing, and other basic needs is still a little bit too much government intervention. The other challenge with the health savings accounts in Singapore are that people can spend money on ineffective care or they can forego effective care because they may not have the full information to make the best decisions for themselves. Next, you have France versus Australia, where basically everyone is covered. In Australia, you get free inpatient care in public hospitals and access to most medical services and even prescription drugs. And then you have a voluntary private insurance to access private hospitals. In France, everyone must buy health insurance, and it's sold by nonprofit funds, where public insurance covers 80% of costs, and then the voluntary health insurance can cover the rest. And about 95% of the population has that voluntary care. Most experts will pick France over Australia. Basically, the French system gives everything you want. However, it is expensive compared to most other countries, except for the United States, where France still is considered a bargain. It has done a better job of using markets to create competition between public and private hospitals. It also has fewer people reporting problems getting access to care or having long waits. So generally, the French system is pretty big. Then you have the Swiss and German model. So with the Swiss model, they have a universal healthcare system that requires everyone to buy insurance. There's basically a mandate for those of you who remember Obamacare or the Affordable Care Act. It also had a mandated insurance requirement. In the Swiss model, you have community-rated, guaranteed issue insurance plans to make sure that everyone has basic minimum care. And then 30% of people will get major subsidies to offset the cost of the premiums. Most doctors work on a fee-for-service scale, and patients have a pretty good choice of doctors. The Germans, on the other hand, 86% will get their care through the national public system, with the remainder choosing a voluntary private plan. Most premiums for the public system are based on income and paid for by employers and employees, with subsidies available but capped. Generally, the experts appreciate Switzerland's model. Statistically, it delivers superior outcomes. It has a very similar system to the Obamacare exchanges. Generally, experts are saying the Swiss system is superior to the German one, partly because it just has superior outcomes. It's worth noting that one of the hallmarks of the Swiss system is basically something very similar to the Obamacare exchanges. There is heavy but quite regulated competition among insurers, and it has that individual mandate that requires everyone to get insurance. You cannot opt out of it. As an example, in Switzerland, there are fewer unnecessary hospitalizations as well as lower heart attack mortality rates. Now, if you compared the Swiss system to that British NHS system, that's where people have mixed opinions. Some experts are saying that Swiss healthcare is better quality, perhaps better access, but it does cost more. Whereas other people would argue that the Swiss system is not necessarily as competitive between providers and insurers because it's so heavily regulated. I can speak from personal experience. When I was choosing a health insurance plan for myself here in Switzerland, I did not find a huge difference between the quotes as well as the coverage. There were slight differences, so we mainly picked based on the customer service that we got. But that goes to show you that these companies are not able to offer very different plans. The government basically says, hey, if you're going to offer health insurance, it has to have these minimums. And some people would argue if you're going to have the government that involved, you might as well just go all the way to the British system. The other benefit of the British system is that it incorporates cost effectiveness into coverage decisions, whereas with the Swiss system, it is more of a fee for service and whether or not your insurer will cover it. When you compare France versus the US in healthcare, some experts are saying that France has higher level of access and quality for the dollar, whereas the US has more healthcare innovation for those top research hospitals and for the patients that can afford it. So ultimately, if you are an average person, you may be better off with the French system. If you have a lot of financial resources and access to those top hospitals in the US with the best surgeons and the latest technology, then you might be better off in the American healthcare system. Hey, I hope this was helpful. If you like this type of analysis and video, please give us a like and subscribe to the channel if you haven't already. And if you really want to support more of this content, consider joining and becoming a channel member. Starts at $1.99 a month. Speaking of which, let me just give a shout out to some of the Nerds for Humanity channel members. So we'll start with our highest level, the EVP, which is Kristen Slevin. So Kristen, thanks again for your support. At the vice president level, we have Chris Chan, Laura Lane, Fat Lamb, JM Sap, VLAM, Lock Win. At the hardcore level, we've got Jekka Lego, Phoenix Congress, Koa, Landline, DK, Tracy, David, Adrian, Gene, Chad, Mike. And at the verified nerd level, we have Nell, Elizabeth, Soldier, Emerald, Mercy Ann, Miles, Verily, Doris, Shake and Make, Mick, Sophia, Jadwiga, Gail, James, Hitachi, Your Mammon, Peter, Arez, Albert, Brandon, Yes, Sugar Sweet, Brian, Lisa, and Sydney. And here's an extra shout out to our two newest members, Nell Nieves and Elizabeth Norris. So thanks for supporting the Nerds for Humanity Nation. Keep it real. Goodbye, nerds.